Good afternoon. Can you hear me now? Good afternoon. I apologize for this short delay. I would like to welcome you to the 6th session of the conference that has to do with a topic that we all experience. We have heard many things about it. However, it is a dimension of the crisis that is not that visible, both in terms of policy, but also in terms of management. It has to do with the social dimensions and with the complexity, or better, with the way we manage such a complex issue. So we're going to talk about mental health. We have two representatives of the scientific and political world. However, I believe that we should perceive this session in a different way. We're going to travel back in time in order to learn about the pandemics and the impact they had on mental health. But my personal view is, if we need to keep something from this session, is that the pandemics are a very complex phenomenon. And it is not difficult to understand them by using only epidemiological indicators. Allow me to thank the colleagues that will take part in the session, and I would like to give the floor directly to the Deputy Minister of Health, Ms. Zoe Rapti. Ms. Rapti is a graduate of the Social School of the University of Athens with a postgraduate degree on the International Commercial Law from the University of Kent. She's a lawyer and has 16 years of experience in the local authorities. She had been a candidate European MP in 2014 elections and also a candidate for the parliamentary elections in 2015. Since August of 2020, she was sworn Deputy Minister of Health, responsible for mental health and addictions. Ms. Minister, you have the floor. Good afternoon, everyone. I would like to thank you for the invitation to take part in the Health World Conference and to talk about such an important topic like mental health during the pandemic and after the pandemic. I'm also deeply glad to be among representatives of scientific world, of the political world, and of all the organizations of solidarity. I would like to congratulate the President and the CEO of the American Hellenic Chamber of Commerce on organizing this conference, and also say that it's a great honor to be among so important and distinguished speakers that will elaborate on this issue. You know that in the days we're going through, initiatives like these are very important since they enhance solidarity and provide support to citizens, especially on issues pertaining to mental health. I would also like to say that during the pandemic, the citizens, as we all know, have shown resilience in dealing with its consequences. We would also say that during the pandemic of coronavirus, a parallel silent pandemic was unfolding. The pandemic of mental health that has ravaged humanity and has made the cooperation between states absolutely necessary and has made a necessity to place particular emphasis on mental health. You know that this pandemic led to an aggravation of the mental health problems. It led to an increase of the addictive behaviors, but of course led to a reduction of the possibility of citizens of accessing mental health services. We know that this is true for everyone, without exception whatsoever, and there are global studies that have been conducted and that have shown that there has been an increase of fear, of stress, of anxiety, but also of the psychological pressure exercised on children and teenagers who were the first victims, quote-unquote, of the pandemic, but also on the elderly. And of course, this increase was an increase at the same time of addictive behaviors in children and teenagers. The scientists, as we know, talk about the long COVID syndrome, which is a syndrome developing after one catches COVID-19. It is a syndrome that accentuates the mental health problems, that also creates neurological problems, sleep disorders, as well as many other health problems. We all understand that it is absolutely necessary to mobilize all the states around the world in order for them to support the health systems, which were underfinanced and very, very limited in terms of what they could provide as mental health services. In Greece, the Prime Minister, Kyriakos Mitsotakis, came up with a new portfolio on mental health and on addictions, which I have the honor to head, in order to place particular attention to the importance of providing support to the citizens suffering from mental health diseases. What we are currently doing in the Ministry of Health is to come up with policies and actions in order to support this type of actions and policies. These actions have to do with the recruitment of nurses, but also of ordinary, permanent, but also subsidiary staff, psychologists and psychiatrists around the world. Moreover, we have passed a law on the specialization of mental health professionals because we believe that the training that these professionals have is of utmost importance for the provision of quality services. At the same time, we promote actions for the development of programs of social support and solidarity and for the promotion of mental health actions that we put into force with the local authorities in the context of 72 preventive centers and also in cooperation with OCANA. We provide information to students in schools around the country. However, we have also developed actions addressed to people who are already hospitalized. These actions have become a reality thanks to the possibility we have to provide electronic services. We know that these people are alone in hospitals or at home, need these services, and we are now in the position to provide these electronic services, which, of course, is one of the most important part of the Greek healthcare system. At the same time, we have phones, hotlines that provide services and information to those who need it. We have developed these call centers, call lines, along with Niarchos Foundation in order to ensure the continuation of these services to these people, but also we have developed other call lines for dementia patients, for cancer patients, for those people who want to quit smoking. Last but not least, something that has been repeatedly said is the development of digital tools. The network of telepsychiatry is a very important development. We will try to further develop it in the coming years, since it's a network that provides support to people who need it and who live at remote places. We have many people living in remote places that can enjoy this support thanks to the existence of digital tools. We have developed a very important unit in Castellorizo, this border island, which has a symbolic character as well. And we are currently working on developing similar units in other areas and places. It is very important to say that the community centers are the most important aspect for the provision of services. Unfortunately, in our country, we have very few such centers for the provision of psychological support or for the facilitation of stopping addictive behaviors. I would like to tell you that in Greece, we have also very few children clinical units. We have very few day centers addressed to dementia patients, and we also have very few units addressed to elderly patients. So these are all units that we want to increase in the future by making the most of the NSRF and the Recovery Fund. And at the same time, we are planning to promote and further support the mobile units that provide psychological support to mental health patients. We have verified that these mobile units are the ones that provide the most effective support when they visit patients at home or in the community. Of course, at this point, I would like to underline that the pandemic showed that mental health does not concern only the mental health patients, but the general population. It concerns children, adults, teenagers, people suffering from dementia. So this pandemic showed that the general population is in need and requires this type of services provided by the mobile units. So the mobile units are of utmost importance because they reach the patient at home and provide meaningful assistance and help without them having to leave their home or to be hospitalized in a hospital that may be very far away from their residence. And many times it is the stigma that prevents the local communities to acknowledge that there has been case of a mental health, for example, and that assistance is required. Moreover, we want to promote the provision of support to children, and that is why we have developed centers for early intervention in cases of psychosis, which is a very important initiative, the first initiative in Southeastern Europe. These are basically centers at the level of community that diagnose this type of diseases in children, and that is because 3,300 children per year are diagnosed with psychotic disorders, and that is why it's very important to make early intervention in order to better treat the disease. At the same time, the pandemic has shown that children had to stay at home, which meant that they were under enormous pressure, and that is why they developed addictive behaviors. And that is why we passed the law on the operation of day centers. The first day center will be developed in a university hospital and will provide support to the students. Of course, in the future, we plan to increase the number of these day centers. Another very important part, of course, is the reintegration of mental health patients in society by giving them the opportunity to work in order to get some money and thus be more easily reintegrated. Moreover, we have now taking important actions in order to support the teenagers. We have developed cooperation with big foundations, and we have provided great support through donations. We have collaborated with Niarchos Foundation in order to develop a reference network for children that will actually combine different services in order to provide specialized support, always in collaboration with international institutions. The pandemic has shown the gravity of mental health diseases, and it has shown that the number one thing we need to do as states in our effort to develop mental health policies is digitalization, the development of digital tools. Last but not least, I would like to say that social and environmental changes are very important, and that is why the private sector, along with the public sector, to focus on that and to enhance cooperation both at national and international level, because health knows no borders. Our vision is the optimal utilization of the available resources and the provision of mental health services that will be targeted on the patient, will assure equal access for all without exclusions, because our motto is that no one will be left behind. Thank you very much.
Thank you, Madam Minister. You described a broad spectrum of actions implemented by your ministry. I retained a couple of words, catchwords, that I believe that give the gist. You spoke of resilience. To my view, this must be the ultimate goal. You spoke of solidarity, you spoke of interventions in the community, and you also touched upon a goal setting towards the most vulnerable social needs in order to reduce this vulnerability. We will have the opportunity at the end of this session to have a Q&A session. So without further ado, I give the floor to the second speaker, Madam Malliori, who is well known. She is a Professor Emeritus of Psychiatry of the Athens University. She has served as Council of the World Health Organization on the subject of designing mental health policies and on drugs. She also has a very rich administrative work, if you allow me. She has been president of the Organization Against Drugs, OCANA, vice president of the European Foundation on Mental Diseases. She was president of KELPNO, member of the BOD of the European Observatory on Drugs and Addictions, and have research activity focuses mainly on the fields of social psychiatry, of addictions from drugs and gambling, pharmacology, and infectious diseases with simultaneous use of drugs. You have the floor, Madam Malliori. Thank you. Good afternoon. First of all, let me thank you for the honorary invitation to be speaking in your conference. Allow me to start, first of all, by presenting my own mental burden and bestowing honor to Fofi Yenimata. If she hadn't died yesterday, she would be amongst us, or she would have listened to what we are to say. The title is The Crisis of the Pandemic, the Day After. I believe that in the field of mental health, we speak of the next years, because in contrast to the reactions to physical health, the mental burden is extended, and in many cases, it might be cover the whole life. People want to feel safe. They want to live in an environment stable, predictable, and sustainable. But there are threatening events, especially those that are prolonged, and COVID is definitely an open-end threat. Thus, it has very serious negative impact on our health. Of course, it is a normal reaction when there is a threatening event to have symptoms of anxiety, intensity, insomnia, overreactivity, a mild depression, but it is the intensity of the symptoms and their duration that will determine the severity of those symptoms. Serious threats such as COVID-19 affect the attitude, and one needs specialized assistance because, as we say, from the emotions, so we feel fear, anxiety, sorrow, paradox attitude with great aggressivity, or the use of drugs, and reaction, negative reaction to our environment. And as I said, we speak of an open-ended threat which is being prolonged, and therefore additional problems, financial or others, are a must, or other adjustments that must be made in the family or the society. The deputy minister very appositely pointed out all the particular symptoms that we see. I'll go through very quickly, because at the end of the day, I would not only like to speak of the mental diseases that were mentioned as symptoms and services, but I would like to focus on something else that I keep for the end, and I would please ask to put an emphasis on that. The fact that we have, due to COVID, change in our individual habits, family ties, professional relations, on economy, as well as the modification of our occupation, that's true. We might have physical symptoms, that is, having the anxiety transformed into real pains, a trend for vomiting, a depressive disposition, or apathy to the other extent. We might have changed and affected sexual desire, appetite, smoking and alcohol drinking is increased. Some people might be introvert. Of course, all that these are negative effects, because the psychological burden affects the relations between the parent and child, violence within the family, family abuse, anxiety in the environment, addictive behaviors increase. Of course, hope is the last to die, and there is an increase of gambling, and as well as deviant behaviors and transgression. But also, I would have expected positive effects on mental health, because we had far more free time for forgotten activities, eventual empowerment of the relations between parents and children, activities of solidarity and social empathy. Fathers stayed longer in their families with their children. That was something positive, at least during the lockdown periods, that is. Socio-social care during the pandemic, it was mentioned, it was sufficient, especially in the first stage. We were actually scored very high, not only at European, but at the international level with regard to our reflects. But let me here dwell on the last remark that has to do with the offer of sufficient and right information. As far as press freedom is concerned on how we handle the pandemic, this is a map issued by the European Commission in 2020. We rank very low vis-à-vis the way we communicate the issue of the pandemic. We are rank fourth from the end. That is, we had bad communication on the subject. It is true, mass media, whether we like it or not, affect mental health and well-being, especially when they refer to issues that regard threats on health, public health. We had fake news. We had references, multiple references, on whether citizens comply to the measures. Therefore, the communication mass media must adopt a new direction, putting the emphasis on a more specialized, reliable, and interdisciplinary information without having the daily reference to figures and death toll. We can't say, I make an invocation here, we can't be listening about intubated cases and death toll every single day. We can have another kind of thematics. Those who want to listen about the numbers, they can go to special website. But because I believe the continuous flow of negative news makes us feel uncertainty, anxiety, and incapacitated. Avoiding them is no solution. We must assess the pieces of information, focus on the positive ones, and avoid the negative ones so as to remain mentally healthy. Thank you. We thank Madam Malliori And I really appreciate the fact that you observed the time. And it is clear what you said in the beginning and wanted to demonstrate the role of mass media in the attitude and behavior of society, and in some cases, perhaps, I dare say, in shaping politics vis-à-vis the handling of the pandemic, the management of the pandemic. And now, let us come to a subject that will offer us a viewpoint on the pandemic from another aspect, from the history of the pandemics. Not merely recording historic events, but to what extent history can address the question whether we could be better prepared for such a situation. For this reason, we'll have two distinguished scientists. Madam Gardikas will speak on history, and Mr. Contiades perhaps on some dimensions having to do with ethics and code of conduct. Madam Gardikas is a historian, and she has been associate professor of modern Greek of history, the Department of History and Archeology in the Athens University. She has written many works. She's an author of books on Greek history and a set of beliefs, Malliori and modern beliefs, a book published abroad. You have the floor.
Thank you very much, Mr. Chair. I would like to thank warmly the organizers for inviting me to this very important forum. I carefully followed yesterday's sessions as well as today's sessions, and I see that many of the speakers perceive the pandemic as an opportunity that will give us the chance to restructure the healthcare system of the country with the aim to anticipate future changes. At the time I have been given, I would like to go back in time and see how, under the pressure of pandemics, we have been led to the establishment of the Society of Nations, which we will also take a look at the equalization between the political capacities and the development of policies which actually shaped the framework that promoted public health. These conditions were created after the First World War as a response to a devastating pandemic that afflicted Central Europe. It was a disease, a pandemic that had a mortality of 40%, meaning it was far greater compared to the mortality rate of the influenza pandemic of 1918. Typhus focal points were identified in Central and Southeastern Europe. But with the end of the First World War, we saw a redefinition of the borders following the Versailles Treaty of 1919. Here you can see the older borders, and here you can see the new borders. Consequence of the new geopolitical map of Central and Southeastern Europe were the migratory flows from nationalities that happened to be in the wrong side of the borders, along with the war prisoners. The pandemics and the social collapse were a phenomenon also that followed the end of the First World War. Poland was at the center of these developments. There was a new state that was created by the Versailles Treaty, a state that was severely tested by the pandemic. The director of the Polish Health Institute was the bacteriologist socialist Ludwig Reichmann, you can see him here on the slide, who asked the help of the Society of Nations. And it was how it was developed ad hoc, an international organization, the Typhus Committee. In the committee took part representatives of the Society of Nations, of the League of Red Cross Societies, controlled by the Americans, Organisation Internationale of Hygiène Publique, controlled by the French, representatives of the winners of the war, and other public health specialists. Out of this committee was developed the Epidemics Commission, the activities of which were directed by Reichmann. At the end of 1923, the Epidemics Commission became a part of the central structure of the Society of Nations as a health organization, having as its director Reichmann. It is true that since its establishment, the competences of the Society of Nations for the protection of peace included the management of social problems like refugees, diseases, and poverty. In the context of the health organization, Reichmann extended the competences of the organization since he followed an approach that was focused on the social dimensions of health. That is why the organization became involved in dealing with tropic diseases, children's diseases, standardization of diseases, dealing with opium use, and collection of epidemiological data at a global level. Most importantly, however, Reichmann developed very important networks of scientific cooperation, extending the cooperation between the organization and the American Rockefeller Foundation and with the Soviet Union, even though neither the USA nor the Soviet Union were members of the Society of Nations. The fate of the executives of the Society of Nations in occupied Europe is very interesting to see. In August 1940, that is 1 year after the outbreak of the war, with an expenditure by Rockefeller Foundation, 12 out of the 12 technical executives of the Secretariat of the Society of Nations, along with their families and the archives of the organization, were transferred from Geneva to New Jersey. There, the Institute of Advanced Studies of Princeton included them in the shaping of the post-war world under the American and English hegemony. In order to restore the world following the devastation brought about by the Germans, in cooperation with the Rockefeller Foundation and with the Society of Nations, they manned the department that led to the creation of the World Health Organization. Apart from this development, the ideological thread that links all these institutions was the institutional internationalization, which was a result of the 19th century, we could say. Today, the acute problems of public health, like, for example, how we are going to have an executive branch, depend not on a political action that will be neutral, but on an exercise of political balance, just as it was the case 1 century ago. And as we speak, this is actually a topic of interest of the World Health Summit that is organized in Berlin.
Thank you, Madam Gardika. And we pass to Mr. Contiades, who is professor of public law and institutions of social protection at the Panteion University of Social and Political Sciences. He is president of Themistocles and Dimitris Tsatsos Foundation. He is coordinator of the Center for European Constitutional Law. He is head of the Scientific Council of the Katerina, head of the Committee on the Reform of Local Administration, and member of the National Committee for Human Rights. Mr. Contiades, if I omitted some of your works and responsibilities, I apologize. I think you can proceed with your speech. You gave more than you should have announced, Mr. President. I will try to be brief and limit myself in a couple of thoughts concerning both the past and the future. It has been very well pointed out that we live the century of viruses. Therefore, we must reassess and reorganize the health systems, placing the emphasis in the field of public health. The question, however, you raised very well is whether could the agenda COVID-19 could have been envisaged. At the end of the 90s, quite a number of books were published that warned on the rekindling of infectious diseases and the ever strengthening resistance of virus. Diseases such as the Ebola, the foot and mouth disease, and the swine flu already warned us. Therefore, when in 2020 the public health systems already weakened due to the global financial crisis came face to face with COVID-19, were proven unprepared both for prevention and dealing with it. Therefore, the pandemic was the onset and the occasion for the introduction of a new world bioparadigm at the global scale. Both the crisis that was launched in 2008 and the insufficient implementation of public health programs had as a direct impact the rampant deterioration of all health indices. At the same time, we have the appearance of new social threats with aging population, ever-intensifying migrant flows. All that led to the necessity of a new strategy for public health. Things were like that even before COVID-19. It is obvious, therefore, that in view of this global pandemic, the great emphasis was placed in dealing with the pandemic, and the public health systems were again left behind. Obviously, prevention of COVID was the great quest and became the known and seen ways of social distancing. But that does not mean that we should not modernize the health systems in a broad sense. As far as the behavioral factors of dealing with the factor, the minimizing of that is necessary. There's a huge body of knowledge currently, which unfortunately has not been conveyed and translated into universal programs of non-pharmaceutical interventions. There's a huge gap, many needs, and many things that can immediately be covered. Without previous experience in handling similar threats, the state was invoked through uncharted waters to deal with very difficult and unprecedented conditions. And through that crisis, the nodal role of local administration was demonstrated. Therefore, the day after should, to my view, find local administration with a more enhanced responsibility in issues of public health. The current conjuncture, which is critical, is an excellent opportunity at the beginning of this century of viruses so as to launch this aspiring long-breath venture. But this has to be done through a strategic plan where the necessary specialization of the local administration personnel is necessary. COVID-19 is an excellent opportunity for the structuring of public health with better staffing, gradual increase of resources from various different sources, a well-processed and improved program of vocational training, of lifelong learning of all the health personnel. The experience in Greece and in Europe shows that the involvement of local administration in planning and implementing public health policy, especially at the primary degree, is extended, especially in handling and managing the local hospitals. The World Health Organization had already as a main axis of its policy the involvement of the society, the local communities and local administration in public health policies, as seen in the Alma Ata Declaration of 2008 and Astana in 2018. Under these conditions, I believe that we should seriously discuss for the establishment of first care, first degree networks, and that means a kind of Ionian network between the independent free professionals, physicians, local administration, hospitals. Therefore, approaching this century, we are obliged to rediscuss the organizational model of first degree public health organization in our country. Thank you, Mr. Contiades. And I also thank you for also observing the time. There have some minutes at our disposal for Q's and A's from the public. If there are questions from the public or any comments that one might wish to make. I can't see whether someone. I have the impression that this is not the case. Would any of the panelists would like to take the floor for a second time? I would like to conclude this session going through all four presentations. Something really emerged from this round table. Mr. Contiades grasped it crystal clear. It couldn't be clearer. Is that this pandemic has demonstrated, has promoted certain issues regarding the management of a problem, how can handle it. You all raised issues and dimensions of this pandemic which are purely issues of public health. The emphasis on vulnerable groups that Madam Rapti mentioned, the emphasis on the role of mass media and the way fake news is also disseminated, the social dimensions of mental health as described by Madam Gardikas, which were a central point in establishing the World Health Organization, and of course the role and transition to local administration, therefore first degree health system that Mr. Contiades touched upon. This shows that we must change the paradigm, and this is the opportunity we are given. We succeed from the emphasis that shift focus from treatment to prevention and public health care. I totally corroborate this turn, and I encourage it, and if we were to say something, is a great invocation, boost public health. I warmly thank you all for participating in this roundtable. I wish you every success in continuation and others equally interesting sessions are to follow. Thank you.